y'all, April Green here, registered nurse at the Cosmetic Surgery Center. Today we are going to be talking about an otoplasty. If you haven't already gone and watched the general surgery information video, then go ahead and do so before we get into this. So the items that you'll need at home are your prescription medications, your lab results, some hydrogen peroxide and Q-tips to clean your incision sites with, and some polysporin for after, and you'll also need a moderate compression headband. So I just want to reiterate to make sure you wear a button up or zip up top to surgery that we can put you in after, so we're not having to pull anything over your head. Also very important to shampoo your hair the night before and the morning of surgery so it's nice and clean, since we are working in that area. And you also don't need to apply any hair gel or hairspray to your hair the morning of, and make sure that your face is clean with that face soap we talked about in the general surgery information video, and that you didn't apply any makeup or moisturizer or anything like that. So now we'll talk about post-operative care or after surgery care. So if you ever notice any sudden profuse bleeding from your incision area that's coming out of your dressing profusely, a little bit oozing is normal, then definitely give us a call and remain calm, because if you are freaking out, then that's going to raise your blood pressure and that's going to enhance that bleeding. You are going to restart your antibiotic and your cynic medication after you get home from surgery with a light meal. Do try to suppress any forceful coughing or sneezing for the first 7 to 10 days after surgery. If you notice any bruising in the surgical area, it should be gone within 1 to 2 weeks. Also, if you notice a low-grade fever or that you're feeling warm, just take your temperature, and if it goes above 101.5, then take some Tylenol, or your pain medicine might even have Tylenol in it, so don't double do it. And increase your fluid intake, and if it doesn't go below 101.5 after that, then give us a call. Your head will be wrapped with a compression bandage after surgery. We don't want you to remove this or loosen it for any reason. Also, we don't want you to color or chemically treat your hair for 4 weeks following surgery. It's also probably better not to color or bleach your hair before surgery as well. So if you're going to get it done, please get it done about 2 weeks before surgery. You're also going to avoid any excessive facial movements like straining or leaning forward of the head and neck for about 2 weeks following surgery. If you notice some tightness in your incision area, then you might be moving your head too much, so decrease that. It's also a good idea to just have a soft diet for the first 3 days after surgery, because your ears and this kind of muscle is involved in chewing. So just no food, candy, or gum that's hard to chew. You can begin using makeup and cover up about a week out. Just be careful when applying. And you do want to avoid the sun, which can darken your scars, and you just want to protect those with either like a hat or some really good sunscreen. We have a lot of good options here. Also, don't drive and take your pain medication. Now we'll talk a little bit about care of your incisions and sleep and such. So once that bandage is removed in our office the next day, you are going to start cleaning your incision sites behind your ear. If somebody needs to help you, then that's fine, just because it might be a little bit hard to see. So you are going to take a Q-tip and get it nice and moist with that hydrogen peroxide, and then clean the area, pat it dry with a clean washcloth or gauze or something, and then you're going to apply that polysporin to your incision area. So keeping these incisions clean will minimize the chance of an infection and improve that appearance of the scar. So it's very important that you do that. How much should you clean your incisions? They should be cleaned about 2 to 3 times a day. And then after 5 days, you can discontinue that polysporin use. So, like I said, after that bandage has been removed that next day, you can start washing your hair. Just be careful in your surgical area and don't rub or wash your hair vigorously. Also, you want to avoid blow drying your hair, especially on the warm or hot setting, until your sensation has completely returned. So now we're going to talk about that headband that I mentioned earlier. It should be worn at all times, covering the ears with mild pressure. So at all times for the first week. So 24 hours a day for that first week. And then after that first week, it should just be worn around the house or just whenever possible. You know, if you're driving, wear it. And you're also going to sleep in it for the first 6 weeks after surgery. Of course, you're going to protect your ears from trauma and use care when combing or brushing your hair. Then, talk a little bit about sleep. You're going to keep your head and back elevated for with 2 to 3 pillows or in a reclining chair, or if your bed inclines. This is important to help minimize the swelling. And you're going to do this for 2 weeks following your surgery. And then it's very important to lay on your back rather than on your side or on your stomach. We also don't want you lifting greater than 10 pounds for that first week, and then stay away from any strenuous activities such as weightlifting or running that will increase your blood pressure and can cause bleeding, swelling, and bruising. So like I said, the first post-op appointment is going to be the day after for that bandage removal, and then about a week out for that suture removal, and then if we have to use staples, about 2 weeks out. And then Dr. Brandman will recommend any more follow-up visits. That's really it, y'all. You will get this packet sent to you from Melinda, so if you want to look through it, that's great. It has a couple more things like consents and that general surgery information and our accreditations here. So go ahead and take a peek through it, and we'll see you at your pre-op. Thanks.